Welcome to Sketchy Medic, brought to you by Elevated EMS Education, where we're raising the standard in EMS training. If you're an EMT student, prepping for the NREMT, or just want to sharpen your street smarts, you're in the right place. Let's break it down, sketch it out, and make EMS make sense. Fast. Let's go. In Human Body Part 3, we're tackling shock, what it is, the types, how the body reacts, and what EMTs must do fast. Plus key life-saving topics you need to own to be confident in the field. Let's level up your EMS game, because in this job, seconds count. Every cell in your body is on life support 24/7, needing oxygen, nutrients, and waste removal to survive. The circulatory system is the delivery truck and garbage service in one, moving supplies in and waste out. As an EMT, your job is to keep that chain unbroken, because when circulation fails, life stops. Cells are tiny power plants, using oxygen to turn nutrients into energy through aerobic metabolism. But when oxygen runs low, they switch to anaerobic mode, less efficient, creating lactic acid and leading to cell damage. As an EMT, recognizing this shift is key to stopping shock before it stops your patient. Pathophysiology is the study of how normal body processes break down, causing illness or injury. For EMTs, it's the bridge between anatomy and patient care, helping you understand why a patient's body is failing, how diseases progress, and what immediate interventions can stop small problems from becoming life-threatening. Ventilation can be impaired by a blocked airway, like choking or swelling, by weakened breathing muscles from trauma or illness, or by physiological blockages such as asthma. Other factors, like injury to the chest or nervous system, can also limit airflow. EMTs must quickly identify and fix the cause to restore breathing. The VQ ratio measures how well air moves into the lungs versus how much blood reaches the alveoli for gas exchange. A mismatch happens when one is off, like good airflow but poor blood flow, or vice versa. For EMTs, spotting VQ problems fast can mean catching life-threatening issues like pulmonary embolism or severe lung disease. When the body can't breathe effectively, oxygen levels drop while carbon dioxide builds up. The brain signals a faster respiratory rate to compensate, but without correction, CO2 turns the blood acidic. For EMTs, recognizing this early is critical. Acidic blood can quickly lead to organ failure and death if not treated. Shock happens when organs and tissues don't get enough oxygen, leading to cellular hypoxia. Without oxygen, cells can't make the energy needed to survive. Shock comes in many forms, like hypovolemic, cardiogenic, or distributive, each with different causes. For EMTs, rapid recognition and treatment can mean the difference between life and death. Shock isn't one size fits all. Your patient could face hypovolemic shock from fluid loss, cardiogenic shock from heart failure, distributive shock like septic, neurogenic, or anaphylactic, or obstructive shock from blocked blood flow. EMTs must spot the type fast, because in shock, every second can be the difference between life and death. We will go more in depth with shock on a future video. Shock slams the body into crisis mode. Oxygen to tissues plummets, forcing cells into anaerobic metabolism and triggering severe metabolic acidosis. Baroreceptors fire off alarms, releasing epinephrine and norepinephrine, sending the heart racing. Meanwhile, interstitial fluid shifts into capillaries in a desperate bid to maintain circulation. When the body can't use oxygen and glucose properly, cells are forced into anaerobic metabolism, creating energy inefficiently and producing lactic acid, leading to metabolic acidosis. The brain, unlike other organs, can't switch to alternative fuels, making oxygen loss quickly life-threatening. This is why rapid EMT intervention is critical. That's a wrap for today's lesson. Thanks for watching Sketchy Medic, brought to you by Elevated EMS Education. If you learned something new, smash that like button, hit subscribe, and share this video to spread the word about the importance of EMS education. Stay sharp, stay ready, and we'll see you in the next one, because lives depend on it.